Nephropathic cystinosis, a gap between developing and developed. Definition: Nephropathic cystinosis is a rare autosomal recessive lysosomal storage disease that, if untreated, leads to end-stage renal disease (ESRD) in the first decade of life because of intracellular accumulation of cystine caused by mutant cystinosin.
The development of diabetic nephropathy involves hypertension and hyperglycemia-induced changes in multiple pathways that contribute to morphological changes in the kidneys. The glomerulus is a globular-shaped structure composed of capillaries that are actively involved in the filtration of fluid from the blood to form urine. With diabetic nephropathy, early glomerular hemodynamic changes include hyperfiltration and hyperperfusion, which result in microalbuminuria. Increased afferent arteriole dilation due to a dysfunction in the vasoconstrictive autoregulatory response contributes to increased intraglomerular pressure, which is associated with greater mesangial cell matrix production. Expansion of the mesangial area, an early morphological change with diabetic nephropathy, is caused by greater extracellular matrix deposition and mesangial cell hypertrophy. This expansion is associated with a decreased glomerular filtration rate and a reduction in the surface area for filtration, which marks the beginning of renal failure. As this process continues, the glomerular basement membrane thickens, and this may eventually lead to glomerulosclerosis. All of these changes in glomerular hemodynamics cause stress and strain on the kidneys, which, if left untreated, may result in renal failure.
Importance of the treatment with cristamine. The importance of the treatment is highlighted with cristamine in developed countries, since this treatment slows the tubulopathy and the extrarenal symptoms beyond adolescence. Developed countries. Patients in developing nations. Patients in developing nations have remained largely untreated mainly because of limited access to cystamine. Patients in developed countries. Most patients in developed countries have received cristamine, which enables the transport of cystine from cells and thus lowers the amount of intracellular cystine. Nephropathic cystinosis, a gap between developing and developed. The gap in outcomes in developed and developing countries raises ethical issues. Patients in developed countries, regardless of their adherence to a drug regimen, generally have expectations of a better quality of life, newly available but expensive long-acting formulations of cristamine, whereas many patients in developing countries still have poor outcomes because of restricted access to first-generation cristamine formulations.
The Cystinosis Foundation educates families and patients and medical professionals about cystinosis. It is an ongoing mission that we have extended internationally. On a biannual basis, we host educational conferences for medical professionals and families. This summer, July 24th through 26th, the Cystinosis Foundation is collaborating with the Cystinosis Foundation of the United Kingdom to host the 8th International Congress in Manchester in the United Kingdom. The two additional functions of our organization is supporting the Cure Cystinosis International Registry, which was established in 2010. You can visit the website at cystinosisregistry.org. We encourage every patient to register. This helps medical professionals understand more about this ultra-rare disease. An important aspect of our mission is mentoring the establishment of support groups around the world. Removing the severe, lonely aspect of coping with an ultra-rare disease is very important, and establishing support groups in different nations has helped remove those feelings of isolation.
Thanks.